and peace to you. This is SB Favor Thinking Podcast, and my name is SB Favor. How are you doing today? It is Monday, March 7th, 2022. Another wonderful day and another day to be thankful. And as I always say, if you focus on what is good, then you can project something good to happen. So make sure you focus on all the things that just give you joy, the things that give you peace, the things that make you feel good. But just focus on what is good. If you are out there traveling about, make sure you are doing your part to stay safe. We are still in the middle of a pandemic, and we all have to do our part to stay safe. I always remind you of that because I care. So please keep yourself safe and keep your family members safe. If you would like to give to the podcast, you can give at Cash App. $SB Favor. Thank you so much for your support and your donations. The topic of this episode is women's health. We're going to talk about menopause. We're going to talk about fibroids, Pcos, and the pros and cons of eating right and exercise, because we all are getting older and we must care for ourselves correctly to just be better. We want to be well in every way, so we got to take care of ourselves, y'all. Well, I have a special guest here to discuss all of these things, and her name is Dr. LaKeeya Tucker. Jaki Draper also is here as my co-host, and we have other special guests here on our panel to ask questions and participate in the discussion. Susan Foster is here, Toni Howard is here, and Layla Verela is here. So we're going to get into talking about women's health. Before we start the topic, I also would like to mention to you listeners, please be reminded that the views and the opinions of this episode, the speakers on this episode, is just views and opinions. And I want to remind you, make sure that you see your own healthcare professional to be properly diagnosed or instructed if you have any type of medical issues. I want to be clear about that because this is just a discussion. I got to be clear. All right, listeners? All right. Thank you, everyone, for participating in this discussion. We're going to get right into it, and I appreciate you all for taking the time out to just come and chat with me. LaKeeya, how are you?
I am doing amazing. I always try to make every day awesome.
Yes.
Thank you for having me.
Thank you for taking the time, Dr. LaKeeya Tucker. Thank you for taking the time to chat with me. I appreciate you so much, and congratulations on your recent promotion. And so tell the listeners a little bit about yourself.
Thank you. So my name is Dr. LaKeeya Tucker. I am an obstetrician gynecologist in East Lansing, Michigan at Alliance OBGYN. And we have two locations. One is in East Lansing, one is in Mason, Michigan. And I practice a full scope of obstetrics and gynecology, so I keep women well. I do a bunch of different types of surgery, robotic surgery, laparoscopic, hysteroscopic surgeries, of course, deliver babies via cesarean section, and of course, vaginal births first and foremost. We like that natural birth, of course. Who can beat that? And then I am also the current chief of staff at Sparrow Hospital in Lansing, Michigan.
Awesome. So we're going to talk about medical issues that women experience. One that I thought about recently was fibroids. Another one was menopause, Pcos, and of course, a healthy diet. Let's talk about fibroids first. Tell me about what some women experience pertaining to fibroids. When it comes to the major part of it, why do women get fibroids, I should say?
So, I mean, all of the topics that you talked about, we could talk for hours about all of these different things. We could be here forever, right?
Right.
And of course, I enjoy all of your company.
Mm-hmm.
But the fibroids, as far as that goes, people experience pressure. They experience heavy bleeding. They experience, fatigue, lots of different things, pressure on their bladder, pressure on their bowels, all kinds of different things, just not feeling well. The gamut of symptoms goes on and on. What causes them, there's family history. That's one big thing. So they run in people's families. So you can't choose your family. You can't choose how you're made. There's also, there's some environmental components to that too. When I think about, the different things within the environment that have changed, so there's a lot of different things, chemicals and things like that, chemical structures of things. And that does include some of the different foods that we eat. It can even be, we say, eat healthy, but, some of the foods you've got to be careful with, preservatives and things like that. So there's a number of different factors that can cause fibroids. And some of it, you just don't know. There's still more research that's being done.
Yeah, we were talking a little bit about fibroids earlier, and I mentioned to Jaki that I think that sometimes when we have different medical issues, if we eat better, I think that we can just feel better. I just believe that. I think that food is medicine, and I'm not saying that, you can not get a disease by eating certain things. I don't know that. I'm not a doctor. But what I'm saying is I think that if you eat certain foods, you can feel better. I think if you eat something worse, you can feel worse. So I just believe that. What do you think about that?
Yeah, I think you're right about that. You're, like I said, some of the cards you're dealt those cards. So I don't want to make anyone feel bad about the fact that they have, the condition, because the condition is super prevalent. So many people have it. But when you have the condition, you think about, okay, what can I do that's natural that I can try to reduce my symptoms so that I can prevent Dr. Tucker from having to actually, cut me or, offer her medicines to me or, whatever. So, that clean eating, when you look at, fresh vegetables and you look at, those kinds of things, and you look at, pick up a box and it has, a few ingredients versus like all the things that you don't even know what it is in it. You want to make sure that you try to eat those kinds of things. There's books on fibroid diets and different things like that are out there. Of course, I don't endorse anything in particular, of course. And of course, what I'm saying as far as all of the things is, not personal medical advice for anyone whatsoever. It is, generalities. And, if there's something that someone has, questions specifically about for themselves, I would say that they would need to go and see their doctor and, just make sure that they're getting, the information for themselves that's personal. But these are generalities. I do feel like I agree with you about that clean eating.
Yeah. It's just important. I try to encourage people to eat better because I just believe that, like I said, food is medicine. Jaki, you want to give us some input on this? You have any questions for the doctor? Jaki?
Well, hello?
Yes.
Can you hear me now? Okay, sorry.
Yes.
I was trying to hit the unmute. I was trying to listen.
Okay.
I was thinking about the fibroids. I had fibroids a couple years ago in 2019. I had a hysterectomy, and when they were preparing me for it, they did an MRI and found endometriosis also. So when the doctor came back after my hysterectomy, she said everything was good, except there was still some endometriosis, that they couldn't get everything. I was wondering, is that something that I should be concerned about? Because I'm not having children anymore, so it's not like I need that part of my body. I don't even have a uterus anymore anyway. So is endometriosis something you should be worried about if you don't have reproductive organs? Or
That's a great question. So it sounds like, if we talk about an individual who's had, fibroids and basically had a hysterectomy specifically for that, usually, pelvic pain is one of the things that people can complain about that can cause someone to have have a hysterectomy because of fibroids as well. And it sounds like, there was coincidental finding of endometriosis, which endo means uterus, like the lining of the uterus. And then the metrium, the muscle of the uterus is adeno. So you probably had some adenomyosis, which was causing you to probably have painful, crampy, heavy periods. So, once the lining of the uterus is removed, you shouldn't have to worry about those symptoms really as much because that organ is gone. So those implants shouldn't be as bothersome to you if they're if the organ is gone, so that it can't further spread and you didn't have any further problems after the hysterectomy was done. But endometriosis is a whole nother topic of discussion. So,
wow.
Yeah.
Wow. Susan, do you have any questions?
Yes, I do. The first one is, what supplements, vitamins should women over 50 be taking?
So the supplements, if they're over 50, I generally like to recommend a multivitamin, like just a regular multivitamin in general, for most patients. And typically that's going to have enough calcium in there too, because you want to make sure that you're having, at least like 1,000, milligrams of calcium in a day. And you need some vitamin D, some D3 to be able to absorb that calcium. So you just need to make sure that you're getting that sufficiently, especially depending on where you live. You may not be able to get it from the sun. So you want to make sure that you're getting those general supplements. And it goes back to what SB Favor has said, that, you have to try to eat clean as well. Try to get those vegetables, get some of that natural stuff, because if you can try to get it from the plants, you may not necessarily have to take it in a pill form. Why buy it? And then, you're just going to urinate it out if you're getting too much of it, because most of those vitamins are water soluble. The only fat soluble vitamins that you have are D, A, K, and E. And so those are the ones that really stick with you once you get them in. So the other ones are water soluble. Mm-hmm.
I was just going to say, my doctor just told me that I'm low on vitamin D. Mm-hmm. And I don't go out in the sun because I had melanoma a couple years ago. Mm-hmm. But I used to, because I'm from Florida, and I used to get sunburned all the time. So I know that my future holds that ahead of me, getting a lot of issues taken care of. But I always take a multivitamin, but now I'm also taking a vitamin D. So
right.
It has it, but I'm taking more now.
Right, because the multivitamin doesn't have very much vitamin D in it. It probably has maybe 400 international units of vitamin D3, whereas the supplement that you take, even if you just take the over-the-counter, it can be anywhere between 1,000. You can probably buy up to 10,000 over-the-counter, but they may have to write a prescription depending on how low your D is.
Okay, thank you.
All right, Layla, do you have any questions for the doctor?
Yes, I do. Can you guys hear me?
Yes.
Yeah.
Yes. Mm-hmm.
Okay, I just wanted to make sure. Yes, the question that I have is, what type of birth control would you recommend for a woman over 40? Like, do you think the pill would still be okay for her to take that, or to switch over to something that doesn't have any hormones in it?
Great question. Birth control is safe for a woman who is over the age of 40. The average age of menopause is 51 to 52 years of age. And it depends on what the risk factors are for that particular woman. So if, the woman has clotting problems, like gets blood clots in her legs or her thighs, or has a family history of blood clots, I would be concerned about using estrogens. I would not put that patient on any estrogens whatsoever. I would err towards the side of, using a progesterone only birth control. And there's multiple forms of that, and we tend to like to promote long-acting reversible contraception. And when I say that, that's things like an IUD or a Nexplanon or, a Depo-Provera shot or something like that, as some of the examples, because they're, not in the hands of the user as much as, as us just putting it in as the physician. Also, we just take into account that family history, but otherwise and also if that person is a smoker, if a person is a smoker, no estrogen whatsoever, so we want to make sure that we're avoiding those kinds of things. So really it's taken into account what's going on with that patient to make sure that we're selecting the right birth control.
Toni Howard, do you have any questions?
Okay, awesome. Thank you.
Mm-hmm. You're welcome.
Toni?
Yes, I do. Mm-hmm. I do. So I'm so glad that we kind of touched on endometriosis, because that was something I was thinking about in the back of my mind. So my question is, how do you bring a balance, if it's attainable, between the symptoms of endo and premenopause? And I ask that because it seems like as I've gone into premenopause, the symptoms from the endo has increased like I've never had them before. Mm-hmm. So I don't know if that's like a cause and effect, or like, am I off balance?
Right. So there's a couple things. So with endometriosis, there's the pain, there's the crampy periods, the achiness in the pelvis and things like that. Then the symptoms of perimenopause are just so vast. I mean, we have a handout on our website at my office that you take a look at, and it says, okay, where are you at in the transition? And because the symptoms are so vast, and then, trying to meld these two things together, that's where, an office visit, we sit and we talk and we say, okay, what is your worst symptom? Because we try to fix one thing at a time to be able to say, okay, if we could fix one thing today, what would that be? And so then I would try to work from that standpoint and say, okay, now here's what we can do from, together in this shared decision-making, model to be able to say, okay, what's the least invasive thing that we can do for you? All while you're doing your part as far as, trying to exercise, of course, because, that's going to be helpful for you. Even when you don't feel like you want to do it, you need to do that, drinking your water and being healthy and doing those kinds of things. But, what kinds of things are we going to do to fix your symptom? So I hope that helps.
It helps, because I noticed when I was doing the exercise, the pain wasn't as prevalent, even when I was at a certain weight, if that makes sense. Mm-hmm. Mm-hmm. I noticed that, okay, the pain wasn't, as excruciating. And it's been excruciating the last year or so. And I'm, it's kind of different because I'm not used to it.
Right. And all while, like I said, it's not, pointing a finger going, okay, just exercise. And you think, I'm exercising, I've been exercising. But, it's like you do that piece and then you say, okay, so I've been working out to my maximum capacity. I've been eating well, but yet I still have X symptom, X, Y, and Z. And I'd really like to fix these. And then that's what we do in the offices to try to work through those symptoms one by one. And maybe by fixing one, you end up fixing the other ones, And, it may be in a less invasive way, and sometimes it does entail surgery,
Okay. All right. Toni, you have any more questions?
No, that was perfect. Thank you.
Okay.
You're
great.
welcome.
All
My
right.
pleasure.
All right. The next one is going to be menopause. I mean, you guys talked about menopause a little bit. Menopause, Dr. LaKeeya. What foods should women in menopause eat more?
So as far as foods go, it also too depends on the history for that particular patient, mm-hmm. because, for some people, it depends on the their history, and it also depends on their symptoms. Okay. So when I think about that, it is certainly, it all goes back to that clean eating. It does go back to that, but it goes back to sort of a plant-based sort of diet. I think about that sort of thing. So if you have, we have natural ways of combating menopause, all the way to natural prescriptive ways of combating menopause. So it depends on what that patient's symptom happens to be. And exercise is in there, there's always, prayer, meditation, whatever it is that you do. All of those kinds of things are very helpful for you. As well as, taking sometimes those extra supplements. For some people it is a black cohosh. Some people it is a soy supplement, but some people that, because of their history, they can't take those things, so we could just go down the full pathway. There's a whole list of things that people could benefit from depending on what that symptom happens to be.
Okay. Jaki, do you have any questions?
Yeah, I definitely do. Okay. So how do you know, first of all, as women, we endure pain and discomfort a lot. We just put it out of our mind. We go about our thing because that's just what we have to do. That's our job. And so menopause, it comes with pain and uncomfortableness and all kinds of stuff that you know is natural. So you're like, okay, it's just menopause. I'm getting through it. We're fine. How do you know when you've gotten to the point where it's time to see somebody that something is really wrong here? Because not everyone has to take hormone replacement or therapies.
Correct.
Some people get through it just fine and, and never have taken any supplements. I'm a person that I personally am not interested in taking any kind of drugs. I don't want to take anything that's going to be dangerous for me. When I say I want to live to be 100 years old, I am serious. I want to live to be 100. So if there's natural supplements that, you can get from a vitamin store that would help different symptoms, or how do you know when it's time to see a professional?
Okay, so first off, pain is not necessarily a natural thing. Yes, we do experience pain, but it is not something that we have to deal with. I think that you're right that as women, we do choose to deal with it a lot. And then sometimes we deal with it too long. I think that we have to step back and be well and take care of ourselves and not feel like we have to be strong enough to be able to go in and not necessarily feel like we have to always be the gatekeepers, because we are the gatekeepers where we take care of everybody else and leave ourselves last. And we can't do that. And so we have to go in and try to, change that mindset. I agree with you as far as not necessarily writing those prescriptions first line, because you don't need prescriptions first line for everybody. Some people do, but most people don't. There are a multitude of natural supplements, but even with the natural supplements, sometimes you have to be careful because, like I said, with people's history, it may not be the best for you, because sometimes, like a breast cancer patient should not use a bunch of soy because that is plant estrogen. So there's a number of different examples that I could use. And those are things that we have to think about. But first and foremost, I think that, going to the doctor and getting checked and not thinking that the pain is normal and that it's natural.
Right. Susan, do you have any questions?
Well, my question's not menopause related.
Okay, but you can you can still ask the question.
Okay, I just wondered, Dr. Tucker, who should get the shingles vaccine and when?
I am not a generalist, so I apologize that I don't have that information. I would love to be able to answer that. I could get back with you on that. I as an OBGYN, I don't dispense that one in particular. So I am not up on that 100%. So I apologize for that.
Okay, LaKeeya, you can explain to Susan the information you looked up?
Okay, yeah. Susan, thank you so much for the question. I was able to get some information about shingles for you. You were wondering about the recommended age for the shingles vaccine, and it appears that it's recommended for ages 50 plus or immunocompromised adults. Just wanted to share that with you.
Thank you.
You're welcome. Thank you for the question.
Okay, and Layla, do you have a question about the menopause?
No, I don't have a question about the menopause, but I do have one quick question for Dr. Tucker. Mm-hmm. Do you think that the food we eat affects our vaginal pH balance and or odor?
Absolutely. It can affect the vaginal pH as well as the urine odor. Whatever you eat can be metabolized, and you get certain smells and that you can notice. And certainly, eating, more yogurt and things like that are very helpful, to help with that balance of the pH. Absolutely.
Okay, great. Thank you. I'm fasting today, so I haven't had anything to eat but water.
Awesome.
Yes.
Toni, do you have a question about menopause?
Yes, I do. So is there a way to help decrease hair thinning or falling out when going through menopause?
So, first thing we have to think about with hair thinning, we need to check and see for a patient if there's an underlying concern that's causing the hair thinning to begin with. I always like to get to the root cause, no pun intended, of what's causing something. So, there's a multitude of different hormones. Our bodies are made up of hormones. And, we always, as women typically will think of just we blame our ovaries on everything, but it's not always our ovaries. But there's other hormones, like your thyroid and things like that we can think about. There's the male hormones and things like that we have to think about. So it really just depends on what's going on. As we want to make sure that we decrease our stress as well, that I think that plays a huge part in it. We are the gatekeepers. I said that before. I'll say it again, that, we carry a lot of weight, a lot of burden on our shoulders, and that's heavy. And, sometimes the first thing that we see is that our hair starts falling out, and we're like, okay, gosh, I just want my hair to grow. And it won't grow because you're stressed, and you can't lose weight because, you're not exercising, you're not doing all the things. There's all the things that, that go into play. So I would say first trying to get to the bottom line of what's causing the hair thinning, decreasing stress, drinking water, taking your supplements as you need, and eating. It's going back to that crux of what SB Favor said at the beginning too, of, really just taking care of, your body, just taking care of this temple, really, really doing what you need to do.
Okay. Anyone else have any more questions about menopause? All right, we're going to move on to the next topic of PCOS. Some people don't even know what that is. I'm one that, because I'm not familiar with it. I do know people that have it, but I'm not familiar with it to understand the whole term of it all. And so, Dr. Tucker, can you explain what is PCOS?
Well, in a nutshell, it's a hormonal imbalance, and you will see patients who have PCOS, who typically have a body habitus that looks sort of like an apple. Their bodies are larger on top typically and smaller on the bottom. There's, an imbalance of the hormones, but there's also where the ovaries produce multiple follicles, and they look like strands of pearls. Like, Toni's got her pearls, beautiful pearls around her neck. It looks like a strand of pearls, on each of the ovaries. And often these people have, issues with infertility, not ovulating regularly, difficulty with, losing weight, all of those kinds of things. Having excessive hair growth, so there's a whole bunch of symptoms that these patients can experience, so they may not get their period, regularly or at all. And so we have to think about those different things with polycystic ovarian syndrome.
Okay, I saw a story on television. This woman, she had the condition, and her doctor told her that she was not able to have children, but some way, somehow, she ended up pregnant. So can you tell me about that? How does that happen? When the doctor says you can't have children, and then the whole diagnosis says you can't have children, and you end up having kids.
Right. Well, the diagnosis doesn't necessarily say that you won't have children. Okay. And I think that that's where, I think that it depends on how it's said to you. And I think that that's where you have to make sure that you click with your healthcare team, you click with your healthcare providers, your doctors, your nurses, et cetera. You have to make sure you have a full understanding, because I have never told anyone that you cannot have children unless they don't have a uterus. You know, I can't say you wow. cannot birth a child. I mean, I would tell them that because right. they don't have a uterus. But, you know, I might say that, you know, based upon what I know, the chances are lower. You know, I might say something to that effect,
right.
but I wouldn't tell them that they cannot have children, because, you know, like you said, that person's going to come right on back and they'll be like, see, Dr. Tucker, here's the baby, yes. you know, and I would be glad that they, you know, if that's what they wanted, that they had the baby. But I think that we just have to be careful what we say.
Yes.
I think that just saying, you know, that the chances are lowered, and, you know, that we may have to assist with, you know, helping them to be able to achieve that goal of a pregnancy. So that way they understand that it's may not be an easy road, you know, so that, but to say never is wrong, I think.
Yeah, because I've heard some people on television, that is, say their doctor told them that, and it's pretty sad when, like you said, someone using the wrong words can take the hope away from someone that really wants children. But how does eating right play a part when a woman has that condition, if she eats the right things or eat what is good for her?
Right. So I said that, you know, their metabolism is slowed. So with the metabolism being slowed, it's more difficult to lose weight or to maintain a healthy weight. So it can be very frustrating for those patients to, you know, to go through that. And so it's going to take some encouragement for that particular patient to, you know, to eat healthy. But it is really important for that patient to eat healthy, because otherwise they're going to pick up more weight. And if they hold more weight, they're carrying more estrogen, which makes them less likely to ovulate, which is going to lower their chances of having a successful pregnancy on their own, if that's something that they're choosing to do.
So would exercise play a role in having a balance?
Absolutely. I just always feel like exercise and clean eating, you know, they just go hand in hand, you know, for sure.
Yeah. That's why I wanted to talk about this topic. All of everything that we mentioned so far, I wanted to talk about these things because I just believe that when we exercise, when we eat the right foods, I just believe that food is medicine, and it can enhance our life, help us to feel better, help us to look better. And I just think that having a discipline when it comes to food, I just believe so strongly, and by faith, we have to do our part to just do what is necessary to feel better and just be better, you know, mind, soul, and spirit. And if we're not eating right when it comes to all of these conditions, then we're not doing our part. We can pray about it. We can go back and forth to the doctor, but we have to do our part when it comes to exercise and eating right. And that is why I mentioned that earlier before we started this episode. I'm a fanatic about eating right, and I'm going to keep believing that eating right is medicine. Food is medicine. And yes, we do need doctors. But I just believe that God wants us to do our part when it comes to these conditions to just eat right and have that discipline that is necessary. So does anyone have any questions about the PCOS?
Can I just say one thing too?
Sure.
I feel like, you know, you're spot on with, you know, having that mentality. And I think that it also is important to have people around you who rally around you when you are in a rut.
Yes.
Because we all get into ruts. I don't care what you look like, whether you're stick thin or whether you're like, morbidly obese, or, no matter what you look like, it really doesn't matter. But, you need somebody who's going to rally around you, who's going to encourage you to do better and allow for you to just, to move on that, good path and not beat you down because you fell off the wagon or whatever. I mean, if a patient comes into my office, I don't say, I'm not like, I mean, we all know that we all know what we're doing. If you're eating a box of Twinkies every day, it's a matter of just, talking to, the patient in a respectful way, and also having people around you who will speak to you in a respectful way, but not necessarily enable you, but, because you don't need anybody to enable you. You need somebody who's going to say, hey, let's go out and exercise, or let's go here and let's go do, these things to try to, be more fit.
Yes, absolutely. I agree 100%. It's so important to encourage the next person, and just like you said, have that support system. That is just, it's so vital. Toni, do you have any questions about PCOS?
No.
Layla?
No, I don't. I didn't know anything about PCOS, so thank you for educating me.
You're welcome.
And Jaki?
No, I don't. I had never heard of it either. This was new to me too. Thank you.
Susan?
I'm sorry. I didn't know about it either, so I appreciate the education.
You're welcome.
Great. All right. Diet and nutrition. Lastly, over the age of 40, Dr. Tucker, what would you say is the best foods to eat to balance your hormones? If you can answer that question.
Right. I really go back to the clean eating. I think that, that sort of thing, a clean eating, less ingredients. I feel like you really can eat a balance of foods, not as much, meat, avoidance as much of the red meats, because, obviously there's a lot of, hormones that are in the meats. And you don't necessarily have to follow a vegan diet or anything like that, because, but you can, but you have to be careful with those types of, diets that what you're doing, when you're doing a vegan diet. So yes. I really think a balance, organic things as much as you possibly can, just really clean type eating.
Yeah. Toni, you have any questions about diet?
No, I just know I need to do better. So thank you.
We all do. We're all uplift and encourage each other. That's right.
Yes, indeed. Susan, do you have any questions about diet?
I am a really picky eater. That's one of my biggest issues. Mm-hmm. So clean eating it's something that I know nothing about because I'm so picky and I don't know how to work my way around that. I'm going to research it, of course, but I need helpful tips.
Yeah. So you might be a good person to work with a dietitian. I feel like, there's resources out there to be able to help you with what you have, because, and what you normally eat, so that somebody can, sit with you and say, oh, you like these kinds of foods? Oh, this might be good for you as a start. So then you can get started somewhere. I mean, you may not get to, all I'm going to eat are, everything raw, you might not get there, and that may not be the best place for you, but just working with a dietitian to be able to say, how can I start to do better? That's a good place.
Thank you. That's a great idea. I appreciate it.
Layla, do you have any questions about diet?
Oh, no questions here. I completely agree with you on the diet. Everything we put into our body is definitely crucial to how we feel and our health. It affects our mood, our mental state, our physical state, all of that. So I agree completely.
Jaki, do you have any questions about diet?
Well, I'm just afraid that if I ask this question, it's going to be bad. Now, white flour and sugar and butter. I'm a baker. So I'm a baker, and my cookies are very high in calorie. Do you feel that it is okay in moderation for people to have desserts, or are you saying that you think this clean eating should be super strict and no room for dessert?
I don't know if you heard me say that I eat a cookie here or there. I mean, I
must have missed that. So good.
Right. No, you must have missed that piece. I kind of just, maybe I mumbled it or something, but no. But no, I mean, it's really about focusing on, trying to be the best you. And then, of course, having a cookie. I mean, you got to live a little. You gotta, have that here or there. But, it just, your diet shouldn't be full of the cookies with the big, lots of fat in there and everything like that. It just shouldn't be that, you're having that for breakfast, lunch, and dinner. But yes, certainly to indulge, here or there. Absolutely.
I know how SB feels about eating healthy, and I was even afraid to tell her that I was opening a bakery.
Send me the address, please.
Well, I like my cookies every now and then. I have my little treats too. I mean, I cheat. Come on now, I cheat when it's time to cheat. Yeah, when it's time to cheat, I cheat.
Just still overindulge, yes.
Exactly. Right. You gotta live, like LaKeeya said. You gotta, enjoy your life, but we just have to have discipline. And I think that when you're mindful of having discipline, you know what you should eat when you should eat it. We can't be too hard on ourselves either. We just have to care for ourselves the best way we know how. And like Dr. LaKeeya said, we have to have that support system. You have to be determined. You have to be encouraged to just do better. No matter what your medical condition is, you can overcome it by faith and as well as just doing the work and being inspired to do the work, because all things are possible. And so that's what it's about. Like I said earlier, the reason why I wanted to talk about these topics is because I just want people to know that no matter what you are experiencing in your body as a woman, as you get older, you can just continue to do better as you do the work. And so be inspired, listeners. You don't have to settle for less. You don't have to be discouraged. You can be encouraged. Like I always say, focus on what is good and make the right choices when it comes to your eating habits. And make sure you exercise, because exercising makes the difference. What you say, Dr. LaKeeya?
I completely agree. I completely agree with you. Clean eating, we just need to do that. Mm-hmm.
Yeah. It's so important, because there was a time in my life I didn't always eat right, but I know eating better now. I know the difference. I feel the difference, and it has made a great difference in my life, the way I feel every single day. So on that note, we are going to conclude this episode. And ladies, I thank you so much for participating in this discussion. I'm going to have more discussions like this because it is needed. We're going to talk about some things to make other people think, and we're going to talk about things so that people can feel better about themselves, because that's what SB Favorite Thinking Podcast is all about. So thank you all for being here. And Dr. LaKeeya Tucker, thank you so much for taking the time to just chat with us and answer these questions we all had. And ladies, once again, thank you for participating. Listeners, if you need to reach me, you can reach me at sbfavorite@yahoo.com via email. You can also find me on Facebook, Twitter, and Instagram at SBFavor. I also have a TikTok handle. I'm not dancing over there, but you can find inspirational content. I also have a YouTube channel. Please click the bell so that you can receive a notification each time there is a new episode of SB Favorite Thinking Podcast. Please subscribe to the channel. And when you click the bell, that's what you're doing. You are subscribing to the channel. You can subscribe to me anywhere podcasts are heard. Apple Podcasts, Spotify, Amazon Audible. Subscribe. Thank you so much for listening. And I got to remind you of this one thing. If you would like to give to the podcast, you can give at Cash App, $SB Favor. Thank you so much for listening. And ladies, thank you again for participating in this discussion. Listeners, you have a good day.